Today, I will be broadcasting from the medical office of Dr. Lozano, a specialist in cardiology and internal medicine. Good afternoon, Dr. Lozano. It's always a pleasure.
Thank you, Gustavo. To what do we honor your visit?
I am here today because I would like to know more about heart diseases, such as heart attacks.
Excellent. Just by casualty, today I had a patient who suffered a heart attack.
First of all, what is a heart attack?
Let me explain to you. Look at the heart. The heart attack is a medical emergency that occurs when the blood supply to the part of the heart that has been cut off due to the blockage in one or more of the heart coronary arteries.
And what happened to the lack of blood supply to the part of the heart?
The lack of supply can cause a great damage on the cardiac muscle or even the death of the patient.
What are the causes of the heart attack?
One of the main reasons of heart attack is the ischemic heart disease, which is characterized by the contraction of the coronary arteries in your heart. That normally heart diseases result from atherosclerosis, that is the thickening and hardening of the walls of the arteries. That is caused mainly by bad eating habits and smoking and having just a bad life by smoking.
And how can you recognize a heart attack?
It seems to me that Mr. Arispe could answer you that question.
Sure, I will gladly answer your question. It was a normal day at my job when I suddenly started feeling like a certain discomfort on my chest on the right side, below the sternum, something that I have never felt before. Then the discomfort spread to the arms, shoulders, and the upper abdomen. Later, I started sweating and I had a lot of nausea. That's when I thought something wasn't right. Fortunately, my employees requested an ambulance on time and I was taken to an emergency room.
It is good to know that you are in good state of health after having a heart attack.
Yes, thanks. Thanks to the timely intervention of Dr. Lozano, I have recovered.
Doctor, and how was the heart attack diagnostic?
It's easy. To diagnose the heart attack, the main thing to perform is an electrocardiogram on the patient. If the result of the electrocardiogram confirms the heart attack, the electrical activity of the heart will have to be observed while the patient is in the emergency room to detect any disorders or abnormalities in the heart.
Okay. So now I'm going to make a question to your patient. If I am a doctor, what was your lifestyle like before your heart attack?
To begin with, I am a man, therefore I am more likely to suffer a heart attack. Apart from my age, I have a family history. My father suffered 3 heart attacks before he died. I have been an active smoker since I was 15 years old. My diet was not healthy at all. I did not do any physical activity, in addition to suffering from high blood pressure, diabetes, and cholesterol. So all these disorders in my life were the ones that led me to having a heart attack. That's what the doctor told me.
Thank you, mister. The risk factors that caused the heart attack are clear to me. But now, what are you doing to prevent a subsequent heart attack?
I was in the hospital for 15 days, and since smoking is not allowed here, I decided to quit. I follow a healthy diet and I have been able to lose 20 kilos. I'm exercising daily in addition to taking the medicine that the doctor indicated.
It must be very difficult to change a lifestyle from one day to the next. Really, what did motivate you to make this great change in your life?
I mean, the simple fact of thinking that if it will happen to me again, maybe I will not survive. And thinking about my children who are so small, that motivated me to completely change my bad habit. At first, it was difficult, but it will be harder to leave my fatherless children.
So, as we can see, this can happen again. Thanks to the patient who went to the doctor to check if everything was fine. He realizes some things weren't, so be sure to go and check with your doctor once in a while.
Thanks.
Thank you.
The learning that we obtained during the realization of this project was to know more about heart disease, such as heart attack. It is recommended to avoid the disease. Also, and have a healthy diet. Keep cholesterol with normal limits, as well as blood pressure. People who smoke should stop doing and keep exercise regularly. People who have immediate family members who have suffered a heart attack should follow the above suggestions, as they are more prone to having a heart attack. This project left us a lot of teaching science. With it, we learned that a heart attack can be prevented.